I'm very pleased today to be joined by Carrie Jenkins and Jane Silovsky. In a moment, I'm going to ask each of you just to give us a quick introduction as to who you are, where you are, and the work that you do. So Carrie, could you introduce yourself, please?
Yeah. We had the pleasure of meeting through the National Center on the Sexual Behavior of Youth, which I have the pleasure of being a member of the training and technical assistance team. All that means that I get to work with clinicians across the country, and members of our team get to work with clinicians across the globe in training clinicians and communities in problematic sexual behavior, cognitive behavior therapy, which is an intervention for families who have experienced problematic sexual behavior, and specifically for youth who have engaged in that behavior. I'm a licensed professional counselor supervisor by trade, and I've had the pleasure of conducting this therapy for the last 12 years in a children's advocacy center in Charleston, South Carolina, and I simply love the work.
That's great. Thank you so much, Carrie. And Jane?
Hello, good day. I'm Jane Silovsky, and I'm a licensed psychologist, and I'm at the University of Oklahoma Health Sciences Center. I direct the National Center on the Sexual Behavior of Youth, and we provide training and technical assistance across the country and actually across the world. And our mission is to support better lives through better choices, supporting the children and families, as well as the professionals who work with them and the community, to be able to dispel the myths about this population and support healthy growth and development.
That's great. Thank you very much. It's great too that you're both here, because throughout the day today's Awareness Day, we've sort of mentioned that sometimes there's a lack of research, that's common knowledge that in terms of sibling sexual abuse, it's not a subject matter that's been researched as much as other forms of abuse or other events going on in the family. And also there hasn't been in this domain as much training, but you guys are providing that training to clinicians and practitioners and professionals. So that's another reason why I'm very pleased that we're able to talk about what some of that looks like, because, we talk about it, but I haven't delved into it very much in other conversations. So I'm very pleased to have you both here. But I think one of the great places to start really is to understand a little bit more about the person who displays problematic sexual behavior. Like, it's just putting it into some sort of context. People tend to look at that sibling sexual abuse as well as sort of black and white. It's either abusive or not, and people aren't sure where that line is or what that actually looks like. So if we could explore that, as well as who is this person who is demonstrating this behavior. Carrie, could you just jump in and get us started on that?
Yeah, I'd love to. So a lot of people, I think, work under the perception that there's a specific profile. So there's a certain type of person who engages in problematic sexual behavior. And if we can just identify the traits of that person, then we could, create safety. And really what we know is that youth who engage in problematic sexual behavior are really diverse populations. So if you've seen one kid with problematic sexual behavior, you've seen one kid with problematic sexual behavior, and they aren't representative of the rest of the kids who have engaged in this sort of behavior. There are things that put kids at higher risk of engaging in problematic sexual behavior. The most common belief by practitioners and honestly, everyday people, is that they must have been sexually abused. And while that sometimes is a factor in the development of problematic sexual behavior, it's not usually the driving force. So most commonly, I think we see families or kiddos who have experienced some type of abuse, so potentially aggressive parenting practices, all the way to physical abuse or domestic violence within their home. There are some kids who have experienced sexual abuse. Quite frequently in my practice, we see kids who have been exposed to sexually explicit media. Sometimes that's of their own curiosity and exploration. Sometimes it's been shared with them in some form or fashion. Oftentimes we have families who have experienced some sort of vulnerability within the family. So maybe they have limited means or resources. Maybe they have a caregiver with severe mental illness who's, unable to, or substance abuse issues, and is unable to supervise in a fashion that they would want to because of those circumstances. And other times we have kiddos who just have specific character traits within themselves that make them more prone to engage in these kinds of behaviors. So a lot of times we'll have kids with significant impulse control issues. Maybe they lack social skills. So whereas someone who's very socially savvy would recognize that, hey, this person doesn't seem really into this activity, these kiddos might not recognize those cues and might believe that the behavior is wanted. Sometimes we have kids who have engaged in this behavior and it's just one in a lump of many problematic behaviors they're engaging in. So all kinds of different delinquent behaviors, and this is one of those. And lots of other different kinds of factors that may play into their engagement in these behaviors. So it's quite a constellation of circumstances that might make a youth more at risk for engaging in problematic sexual behavior.
Yes, and then also I think there are those risk factors and some potential signals or signposts, and then there's the other side of the coin is you can have all of that going on and the abuse doesn't happen, or you can have none of that going on and there's still sibling sexual abuse. So that is the area that makes it, I think, more challenging for caregivers and parents to even wrap their head around this. And would it be fair to say, Jane, do you think that one of the other things that gets in the way is the whether it's societal or parental or caregiver mentality that children can do no harm to other children, whether that's, a child down the street or within their family, that these are just little angels, and the idea of sexual abuse is we only talk about that when we're talking about older teens or adults. Kids don't sexually abuse. Is that another thing that sort of gets in the way of this whole conversation?
It's a very important point, Nancy, is to think about how we perceive children, and that impacts our response. And definitely a perception that's out there is that children wouldn't do these kinds of intentional harmful behaviors that can hinder our then response and fail to get help early when it's really needed. I think what's important to bring up here is that most people are making decisions based on myths when it comes to children with problematic sexual behavior, because we as a nation and as a world have not raised this bar of truly understanding sexual development, how to promote healthy sexual decision making, and what are the reasons why problematic sexual behavior can occur and how to address it. And so a lot of times our response are good intentions, but based on myths, such as is what you said. Kids don't do this kind of harm. The boys will be boys, is sometimes said. The other end of it is perception that they should be locked away and sent away. The belief that there's something core wrong to them as a human being, and not really understand the diversity and the responsivity of the behavior to effective interventions.
And I think too that one of the things that we forget about is not forget about, but other myths are this behavior has no negative impact, or it's like one instance, and there's maybe one instance of genuine non-harmful curiosity between youths, and that's okay and part of normal development, as it were. But this idea that I've heard many stories or several stories of parents who sort of say, oh, well, we're going to talk to the child who's done the harm. We identify it as harm. We're going to talk to them, and then it's never going to happen again, so we can just forget about it. Not recognizing that not only is there impact for the person that was harmed, the child that was harmed, but also the person who harmed, who is, 12, 13, 15 years old and doesn't necessarily fully grasp because of, say, developmental issues or whatever, doesn't fully grasp the extent of what they've done until they're much older. So the myths of children don't do this and then if they do it, it's not that big of a deal. And then, we don't have to spend too much time worrying about this because it's not an issue. When in actual fact, we know, and particularly yourselves as those who research and work in this domain very specifically day in and day out, you know quite clearly what the problems can be, and not just for the children, but for the whole dynamic of the family. So caregivers and parents have this immense responsibility, just generally anyway. I mean, parents just do. We also have this fear, as when we get up every day, that we're going to mess something up. And quite often we do, there's something that gets messed up. But what is it then that, I've had other conversations about prevention, signs to look for, and things to do if there's disclosure, but we can never rehash that stuff enough. Like, we can never talk about it enough, because this day in particular is about helping parents to understand this particular thing, in particular, prevention, signs to look for, and what to do if there's disclosure. So the responsibility then on the parent is immense, but what messaging would you want that parent or caregiver to have in order for them to sort of be okay with that responsibility and be able to take that and turn it into a type of curiosity and desire to be supportive of their kids?
What's essential is to think about that this is serious. We really have to make sure everybody's okay. And that involves a good quality clinical assessment and not ignoring the potential impact on the children potentially harmed by the problematic sexual behavior. You're spot on that unfortunately there is a myth out there that this will not really cause harm, and if we just don't talk about it, it will go away. We know that it can cause harm, similar to if an adult conducted the sexual abuse, and it needs to be addressed. So it needs to be addressed seriously to prevent any further harm. The second message, which is as important, is that there's hope.
Mm-hmm.
That there are strategies to heal as a family and to prevent this from reoccurring and support the well-being of all. What that looks like will be different to different families. As Carrie shared, it's a diverse situation, diverse reasons why it happens. And so that needs to be taken into account. But the good news is recidivism, which is a fancy word of saying it happening again, is low, 2 to 3%. And the good news is caregivers make such a big difference. So when we look at treatment and what are the core components related to positive outcomes, both for the impacted child and the child exhibiting PSB, it's the caregivers, it's the parents. And it's the parents being able to learn how to support, communicate, supervise, guide, nurture, and help put their children back on the right track. As you mentioned earlier, parenting is hard. It is not well publicized how difficult it is to be a parent. And none of us are given a book that tells us how to manage sexual development of all things. And so if the parents listening hear nothing else, I hope they hear they are the key to the solution. And when we as therapists ask you to be involved, we're asking you to be involved because that is so true. It's not because we think there's something wrong with them or their parenting. We know every day they're doing the best they can. Multiple things got involved where they got off track, and good clinical support for them and their children to process that trauma, to not hide away from that trauma, to put it out there, address it, provide guidance, to do healing, to learn how to make good decisions and how to communicate as a family moving forward is the key for that healing.
And I think this is a great opportunity to dive a little bit more into what some of that treatment look like. So we've touched on it in this conversation and in other conversations, but I haven't had a conversation with anybody in today's event about what actually that treatment looks like. In psychology, there's all sorts of different approaches for something, but you work very specifically with problematic sexual behavior, cognitive behavior therapy. So for both of you, sort of what does that look like? What is going on? What is the dynamic? What if people, if parents have discovered that sibling sexual abuse is occurring in their families and they're brought into a system and it's sort of like, okay, this is the approach we want to take. What could they expect?
Why don't I give some broad things and then pass it to Carrie to give some specifics in terms of the therapy approach.
Sure.
So in terms of the research out there, there's a couple treatments that have growing evidence around addressing it. One is multisystemic therapy for problem sexual behavior. The problematic sexual behavior, cognitive behavior therapy is a group or family approach. And then other similar types of treatment has been successfully utilized with children and adolescents. Again, core component is the caregivers involved. So a red flag for a caregiver, if they're starting treatment and the therapist wants to talk to your children and does not actively involve you, that would be a red flag that perhaps they don't have the information necessary to really address, because the caregivers should be actively involved in the process, looking broadly at the protective factors of the family and the community, and what are the vulnerabilities, and together creating a treatment plan to help raise those protective factors and address any ongoing vulnerabilities. So there'll be nuances so that it would fit the family. I'll pause and pass to Carrie to talk some more about, from the family perspective, what the treatment will look like.
Great, thank you.
Yeah. So as Jane said, it should be a collaborative process, right? Where the caregiver is involved in helping to identify what they think their child needs to support them growing and making healthier and safer choices. Some components that we would recommend would be talking with the caregiver about their current parenting practices. Are there things that they can do to help their child understand basic rules in their home and what expectations there are for them in engaging in ways that feel healthy and safe? Right? Talking to caregivers about sexual health and sexual development, talking to caregivers about rules related to bodies are all going to be really critical pieces to helping the caregiver be the person guiding that child in making healthy and safe choices throughout their future. For the children, focusing on helping them identify how to engage in self-control. So how to recognize, when am I about to make a choice that's probably not wise? And how can I stop and make a different choice? And that's really tough for young kids. It's tough for adolescents. It's tough for grown-ups.
Yeah.
So recognizing that, we can stop and make a different choice before we act impulsively or act out of curiosity and take into consideration the people around us. Working with kids to understand consent from a very young age, right? I teach my 5-year-old that no means no, and your body is yours to do with what you want. And kids of any age can understand the concept of body autonomy and recognizing that others have the right to body autonomy. Teaching healthy and appropriate relationships can be really helpful in understanding these are the feelings that I am having, and recognizing the feelings that others are having, and seeing and respecting those feelings. Again, I mentioned social skills as a possible connection point or risk factor. And so teaching kids how to recognize those social cues, and how to see the perspective of another can be really helpful. So lots of different opportunities for addressing things, again, depending on the need of the child and the circumstances of the family.
And I think that's great, particularly the idea of the ongoing help and support for caregivers in communicating things, sort of like, because the therapy isn't there 24/7, the support isn't there 24/7. And quite often as parents, I mean, you know, we don't have all the skills. As you were saying, Jane, there is no book. And really, if parents really fully realized what it was going to be, it would be like, nope, not doing that. But like, so that ongoing education for the parents and the support, because they're also going through their stuff too while they're working this out, that one of their children has harmed one or more of the other children. And then there might be other children that require support as well in their learning about what's happened elsewhere in the family, as it were. So again, another reason why seeking professional trained support is so important. And I've mentioned this in another part of today's event, that, you know, what parents tend to do when they run into trouble with their kids is they go and they ask their friends for help. And that's great, you know, get emotional support from your friends, but quite often your friends will be also misinformed or operating on assumptions and myths, and they don't have the professional understanding to necessarily know what's next. But I think it's also reasonable to say, you know, that perhaps you need to find the right type of support, because not every professional is trained on this yet. We know that, as you were saying, recidivism, that is a big word. I don't know why I keep trying to say it, because sometimes I mess it up, but that time I got it good. We know how successful that can be. And also, you know, kids are not pedophiles in waiting, and they're not mini criminals. They are making decisions, as you say, Carrie, maybe impulse issues, lack of understanding of consequences, lack of, say, maybe a little more at that point narcissistic than socially skilled, and, you know, not aware of respecting another person, et cetera, et cetera. But all that being said, we want to be hopeful about the future of the family, but also about the future of sibling sexual abuse and talking about it in future. So with that in mind, you know, we want to leave this conversation with this idea of being hopeful. What exactly does that look like in terms of types of therapy, what can happen in families, and, you know, society as a whole? So Jane, I'm going to ask you that one first. Just throw that big question at you for, you know, here you go.
I think something that can help think about hope is to hear the words of other parents that's walked down the same path. And we have a caregiver partnership board that is led by parents who have had youth with illegal, problematic sexual behavior, who've acted out on family members or people in their social network. And they have developed guides for parents so that they don't feel alone.
Mm.
And I know, Nancy, on your website, you're hoping to share all of that, but their tip sheet from parent to parent saying, when you're in that panic zone, here's our survival guide.
Mm.
Here are thoughts, things to think about, to hold yourself together, because you can get through this. When you're looking for treatment, here's our guide of what to look for treatment and what things should be red flags and concerned. And the other thing, which was actually the very first product they developed, was a prevention, because they all said if we had had the right information, we potentially could have prevented this in the first place. And so it's called Talk About the Elephant in the Living Room. And it gives parent and grandparent and other caregiver guide to other parents about talking about the tough stuff, so that your child comes to you with thoughts, feelings, and questions, and you can help them be on the right path.
Yeah, and that thanks for reminding me about all those resources, because they will be included in the resources pack, links to various pages on your site, because they're such good quality information as well. And I love that a lot of the resources are being created by those who are involved, the parents and the caregivers. And you're right, we can learn from others who have been down this path and are able to share their experiences with those who are just stepping into it. So, and Carrie, what are your thoughts about, let's go to that conversation about what needs to happen so that 5 years from now, we're getting back together again on the 5th annual Awareness Day, or SiblingsToo Day, and we're having a different conversation. So what needs to be happening, and what are your hopes for what that conversation realistically could look like?
Oh, that's a hard question.
Sorry.
I think exactly this, right? So parents and caregivers being proactive, finding out information, seeking out information. I think the more people that know about this situation, the better off people can be. Sometimes families share that their experience with the system was very confusing. They got a lot of mixed messages. And so I think the more professionals that understand about this population, and the more people who have experienced it, who feel safe to share, is going to be hugely helpful. I think also just caregivers understanding that initial paralysis, or just full overwhelm feeling, will go away. And the more you move through it, the easier it gets. We certainly have families who say, like, I don't want to get back to normal because what that wasn't healthy or safe for any of the people in my family, but we want to find a new normal. And on graduation day, they say, we have our new normal. Or we're getting there. Maybe they're not there yet, but they're definitely on their path. And that's a really beautiful thing. So knowing that there is hope. Sorry, my cat really wants to join our conversation.
That's okay.
Knowing that there is hope and that there is healing for the whole family, I think is hugely powerful to hold on to.
I think so too. And I think, that initial overwhelm, feelings of anger and frustration and fear when it's realized that a child has engaged, in problematic sexual behavior, all of that is very overwhelming. And we in all aspects of life, I think we always need to hang on to a degree of hope and optimism. The big message for me, for whether it's the child being harmed, the one causing the harm, the parents, caregivers, or any other family member, you are not alone. There are people out there who can support you. I know when I was growing up, because you both know I'm an adult survivor, when I was growing up, this conversation never happened anywhere. And so therefore, there's a real feeling of being alone. So more professionals being trained, more conversations, as you say, Carrie, these sorts of things need to be happening, and I think they will. It's a strong message that is coming across in the Awareness Day, and even preparing for the Awareness Day, is there's a great deal of desire by professionals, academics, and lived experience experts of collaboration, and making sure society talks about this. And one of the other things too is learning how to deal in advance, or prevent in advance some terrible things from happening. Even if they never happen, is never a bad thing. It's never a bad thing to learn how to communicate well in your family, and to talk about very difficult subjects from when everybody is like 2 months old, basically, like that's an exaggeration, but you know what I mean? It's creating that environment's never going to be a bad thing. So doing that in advance may mean that you're preventing it, but even if it was never going to happen anyway, you're creating a whole new family dynamic. So I know our time is short today, but I really appreciate both of you taking the time and joining me in this conversation, because you bring a degree of expertise with you and understanding. And also, I want for people to know that, for example, your program, the problematic sexual behavior, cognitive behavior therapy, is being delivered out, and people, more and more people are being trained in how to do that. And we know from other forms of situations that cognitive behavior therapy is very successful. It's a very good therapy to engage in, and so that it's being applied in this domain, I think, is very important for people, again, to know that that stuff is happening. And so I want to thank you both. As we wrap up, do you have a final thought or message that you want to share with others or the audience that are listening in?
Nancy, I want to thank you for organizing this and pouring your heart and soul to raise this topic. It's very important, and having lived experience voice throughout is essential for change to happen. And we really look forward to our continued collaboration.
Oh, that's great. Thank you very much, Jane. I appreciate that. Carrie, do you have a final thought?
No, thank you so much.
You are very welcome, and thank you again both for your time today. I sincerely appreciate it.